Yeah. All right. Well, I'm just counting 1, 2, 3, 4, 5, 6, 7, 8, 9. This is my doctor. Where is Miss Melissa at? I don't know how to reach her. Melissa at my DR. Yes. Here she is. Here she is. Hey, who's just going? Where's my Melissa? Okay. Not finding. It doesn't want to find me. It's out there. That's why. All right. Okay. Well, we're just gonna turn this around. Very sketch. 3 people. That's not bad. Because I was trying to do like a total head count because we originally had like 28 people signed up. I'm like, I don't believe that. I did have a couple people like today say they were sick or they overbooked themselves or they thought it was tomorrow. So anyway. So this is mine. All right, so I just kind of like made these slides just to keep myself on track because I talk a lot. But I just wanted to, the whole reason that I even put this up on the Facebook is because every hour on the hour when I'm training people, literally all we talk about is hormones. That's all we're talking about. So I'm having this problem, I'm having that problem, I'm not sleeping, my hair is thin, my cholesterol is high, my shoulders bothering me all the time. And so I will just tell you for the last April, and this is, I'll introduce you to, this is Dr. Melissa Torres. I asked her to come in here today with me. She opened up a practice. I've been friends with Melissa for a while. I trained her for a little while, and she used to be right next door at daycare. And then she decided to have another baby and take some time off. And then she and her husband opened up a practice right up the road, actually. So just past Crystal Beach on the left-hand side, the plaza. I don't know the name of the plaza. Coconut Grove. Yeah. So she's got a really great practice over there. And so she's, I asked her if she would mind me shouting her out a little bit because, and then, I don't want to make any mistakes with any medical things that I say. And then, Jenny, she's Dr. Buck. Is here to always our resident gynecologist, who I call her with every ache, pain issue. What's going on with this? And she's like, well, it could be. Do you need me to write you a script? So, pretty much. Yeah, she's great for that. She'll like pull it out of her pocketbook. But so. Melissa's going through the certification through the Menopause Society, and so she's not finished with that yet. But once she does, she said, "I'm not a hormone specialist yet, but she will be." So she's going through the certification now. And then Dr. Reyes in Tampa. I don't know if you've ever heard of Dr. Alexandra Reyes in Tampa. A lot of you have seen her now. She is certified through the Menopause Society, and I see her. I do telehealth with her because she's in New Tampa, and I don't drive that far. So she's in New Tampa, and she and I Zoom every 6 months or so. And I called her last April because I'm like, all right, my eyes water. I don't know if this happens to anybody, and I'm gonna open this up to say what's going on with you guys. But my eyes, if you come into class, you'll see me grab a tissue because they just water all the time. I'm like, why is that happening? It's driving me crazy. It's like just started happening in the past couple of years. It's driving me nuts. My hair is super thin. I'm like, why am I all of a sudden on the scale so much higher? I'm eating so much. I'm eating the same. I'm working out the same. What's happening? And so I was reading about perimenopause and all the symptoms. I'm like, check. And there are 66 known symptoms of perimenopause now. And so I was like, wow, got all of those. But and a lot of you have them also, and you don't realize that's what it is. So that's why I've got a lot of people that have been having a lot of shoulder issues, and one of the biggest symptoms is frozen shoulder, and people don't realize that that's part of it. And so, and a lot of times estrogen can help that, and people are afraid of estrogen because of the Women's Health Initiative study that happened stating that you take estrogen, you get cancer. And so that they found that is incorrect, and that was not a correct study. So I wanted to kind of just open it up and let everybody know. I, believe it or not, am not a doctor. I know this is shocking to all of you who call me and say, what's wrong? This hurts. But because I'm not a doctor, I wanted my doctor friends here to make sure I didn't misquote anything. But I wanted this to be an open discussion, basically, so everybody can kind of share their own experiences. What's going on with you? What are you doing? What do what have you learned that has worked for you? Because I'm just kind of sharing it hour by hour with people, and I just thought it would be cool to have a group discussion, which is why I wanted to invite you guys here. And so most people don't know, and this book. Does everybody have this book? You don't have this book. You need this book, the new Menopause, because it's free on Spotify Premium. So if you guys have Spotify Premium, just download it. It's free.
What's it called?
The new Menopause. You'll see my little pink notes because I figured I'd read some of it. And also I have a lot of non-alcoholic drinks over there if anybody wants some.
Keep finishing them off.
Yeah, finishing them. Yeah, this is all that goes. I have regular big wine glasses in the kitchen if you want to grab one from my other party. I thought those were so cute. I got those at the dollar store. I thought they were so cute. I gotta keep them off. I just want to. So basically, you guys, I don't know. You're gonna know a lot of this, but what you may not know. So do you know that it can start as early as your early 30s? All these things can happen. And so when I started having this dry eye thing, I didn't realize that was a symptom. And so I just kept thinking, I need eye drops, or I need medicated this, or I need medicated that. And then when, like for you example, when your shoulder issues, I'm like, have you thought that it might be because of perimenopause symptoms? Have you had your hormones checked? And it can last for so many years before you go through. I haven't hit menopause yet. So has anyone who's in here that has already hit it? You're done.
We still have things even after menopause.
Yeah. Oh yeah, definitely. And someone else is walking in. So one of the things I wanted to ask everyone, hey, Amy, come on in. I was gonna say, I think there's one chair left over there. Yeah.
And I can sit on this.
Yeah, sit on over. There's a ball in the corner too. Yeah. What I wanted to list was just a couple of the symptoms, and you guys shout out. Okay, so we all know the regular hot flashes and night sweats, right? We all know irregular periods, heavy periods, light periods, missed periods, breast tenderness, mood swings, anxiety, depression, panic attacks, irritability, fatigue, insomnia, brain fog, memory lapses, difficulty concentrating, weight gain, bloating, water retention, joint pain, headaches, migraines, heart palpitations, dizziness, tingling extremities, burning tongue, dry mouth, gum issues, allergies when you've never had them before, body odor changes, thinning hair, dry skin, itchy skin, acne, your nail changes, digestive issues, loss of libido, vaginal dryness, painful sex, frequent UTIs. That's one that I see all the time in here. Frequent UTIs, people don't realize that's part of it. Incontinence, which also could be pelvic floor issues, which we work on all the time also. Back pain, hip pain, restless legs when you've never had that before. Cold flashes, electric shock sensations, tinnitus, dry eyes, watery eyes, blurred vision, increased facial hair, crashing fatigue, sweating way easier than you've ever sweat before, feeling really overwhelmed when you've never felt that before, sadness, anger, crying spells, lack of motivation, low self-esteem, feeling invisible, loss of joy, social withdrawal, a relationship issue.
Kind of sounds like my teenage girls.
Yeah, it sounds like teenage years again. And so one of the things that so has anybody not experienced any of those? Everybody's got something. And so is anyone now taking any kind of HRT?
Progesterone.
Wow. Okay. So is everyone on progesterone?
Yes.
Okay.
Pregnenolone.
Okay. And is anyone not on progesterone? You. Okay. One, two, three people. All right. I'm going to raise my hand on that. What about is anyone just taking only testosterone? And just say it because who cares? Everybody just take this testosterone too. All right. Okay. Is anyone on all three? All right. So is anyone really afraid to take any of those things? Yes. Two. Do you mind sharing why?
Well,
the hormone issue. So my
Okay.
grandmother had breast cancer. They said it was hormonal instead of
Mm-hmm.
in the family.
Okay,
So that's I try to stay away.
okay.
I was just gonna say, I tried,
Mhm.
and then my doctor scared me, right? It was
Okay.
kind of like there, he keep referencing that old study of, but all this could happen. kind of
Right,
thing.
right.
So,
Okay,
a lot of it is if you've got a history of breast cancer, from what I understand, correct me if I'm wrong, that if you have a history of it, then yes, there's a good possibility. If you don't have it in your family, then you're not gonna have issues.
okay. Does anyone want me to read the book about that?
Yes.
Because I actually looked that up because that's such a big discussion is the breast cancer. And I had a friend that was coming today that has just gone through breast cancer, and her grandson got sick and she had to stay home and watch him. So I was really hoping she would come because this was interesting to me. I did. Hold on. Okay. 1 second. 1 second. Breast cancer. Okay. So the decision to embark on, they call it MHT in here, not HRT, because they're calling it now menopause for hormone therapy. So if you guys see MHT instead of HRT, that's what it is. But so I'm just going to read a couple of things from here. She says the decision to embark on MHT should always be based on your unique medical history, risk factors, and symptoms. But then it talks about in 2020, the British Menopause Society released findings based on an evaluation of updated science on hormone therapy use after certain types of cancer. And the evidence reviewed suggested no increase of risk of recurrence with MHT in women with early stage cancers. Evidence also showed no adverse effects on survival rate with hormone therapy in women with ovarian cancer. On women with a history of breast cancer, their conclusion that it should be a contraindication. But then it says a later analysis that was published in 2022, based on evaluation of over 8,000 post-menopausal breast cancer survivors who use various types of hormone therapy, researchers concluded that neither vaginal estrogen nor MHT was associated with increased risk of recurrence or mortality. They did find an increase of recurrence, but not mortality, in those who used vaginal estrogen while taking, okay, how do I say this? AROMATASE.
Aromatase.
Aromatase inhibitors. What are those?
That's like the people that they take for breast cancer to block the estrogen receptors.
Okay. All right. So basically it seems to be very much like some say it's okay, some say it's not. So do you have anything to add to that you're looking at me like not sure?
No, and I also would say the testosterone part for the pellets, I always worry about clitoromegaly, because that's permanent.
What is that?
So when the clitoris is enlarged like a penis, so that is permanent. That needs surgical correction.
Interesting. And they're saying that's with pellet.
Because the pellets usually get you to a male range, right? And if you stay within a female range, maybe a little higher, maybe, but not like in the 200 to 300 range, right? That's male range. So if you're in like higher female, usually that's better with like the gel and the cream. But like I usually see the pellets and then they come in and it's like 300.
Right.
That's more risk of like clitoromegaly.
Interesting. That's what I have got.
Well, I would just hope that I don't know who's giving them 300, but that's really bad dose. I mean, I've been on testosterone for like 7 years, and I mean, there was like one time that they accidentally dosed me wrong, and it was like 300, but otherwise it's always like between 50 and 80 or
Yeah, that's good. That's good.
I would say the people that are on testosterone generally feel pretty good.
Yeah.
Yeah. That's what
When it's dosed correctly,
When
you
it's
know
dosed
what I mean?
correctly.
Like they're like,
Pellets or are you talking pills?
yes, I don't know what she's done.
yeah, that's one of the things that I wanted to ask how many of you, if you don't mind saying who's been on the pellets. So 1, 2, 3. Okay, 4. And you went off of it. And why did you go off of it?
I wasn't seeing any like relief from like I didn't see any effects from it that it made sense.
Okay.
I hated going in and getting the stupid pellet.
Okay.
I did it like 3 times.
Yeah.
So it's not like maybe a year.
A year. Okay. So for just from the general experiences that I've heard here, and Jenny has told me that she has a lot of patients that love the pellets. The people that I've had here don't. And I didn't know she had been on them and she likes hers. The majority of the people that I have talked to have been overdosed on the pellets. And then they're messed up because it's in their body for a while. And but then there are a lot of people who love them. So it's good to have experiences of both, you know. Dr. Reyes only prescribes the cream.
Yep.
She only likes the cream. But then I have had, go ahead.
I've done the creams and they didn't really notice anything,
Okay.
and so they switched me over to my compounding pharmacy, which is a small sublingual testosterone. And I went from a 5 milligram to a 10 milligram, and I've been on the 10 for probably maybe 8 months now, and I felt great. I loved it, but I feel like I've maxed out on it now.
Mm.
So I thought I was doing great at 10, but apparently everybody else is doing like much higher. So I'm probably on the lower spectrum of it, just working my way up. But I did feel great off the 10. So now I think I am ready to kind of like, but the sublingual helps me tremendously because I didn't like I never did the pellet. I just heard so many, again, negativities because of it. The creams didn't do anything for me. So that to me was the next level up. And I did the little troches. They didn't do anything either, but these little sublinguals, those have just done really well for me.
Okay.
So I have something just from personal experience about the pellet. So it really can vary from, so for instance, my OBGYN was giving me the pellet, worked for a while, but then I just like that, I stopped feeling like it was doing anything, my blood work. So say it's not cheap either. It's like $400 every 3 to 4 months. So I wasn't feeling any difference. And so I was like, well, let's do my blood work. Well, they were giving me pellet and I wasn't in the target range and they weren't increasing my dose. So basically I was paying for nothing. So I got irritated. I went to a different provider. But what I learned is that it can vary between what compounding pharmacy they get it from. It also can vary by the placement. So if it's too deep or too shallow or whatever,
Oh my gosh.
then it can, because you have to go to somebody that knows what they're doing. If they place it wrong, then you're also not going to get effects correctly. But it's on the same dose when I went to the different office and totally a different experience. My blood work was different. I felt different.
Got it.
So,
Got it. Anybody else?
I've been on the injection testosterone. I give myself an injection like every 10 days.
Okay.
How strong is it?
I dose it based on like lab work. Like I get lab work like that.
Lori's
Yes.
For you?
The happy hour group.
I probably should have put name tags on you guys, sorry, I know most of you guys are together. But go ahead, so you do the
Injection. So I believe I think it's 50 milligrams
okay,
that I do. And he's told me just do it however I feel good.
Mhm.
And then we just frequently check labs.
okay,
So if I feel like I'm getting too much,
okay,
then I just kind of back off.
interesting.
Do you feel consistent results?
I do. I've been on it for a couple of years now.
What do you feel when you feel better? What do you feel different?
I just have more energy and more endurance. Like I do like high endurance cycling. When my levels aren't right, I get tired of it.
See, that's what I'm noticing now. I'm getting Mrs. more fatigue quicker
Yeah.
than it was before.
And there's like muscle growth too.
Yes.
You mentioned when they're too high, what is that?
You just get more, I don't know, it's irritated.
Angry. Yeah,
Yes.
yeah,
Yeah.
definitely angry, alright. So you guys understand what all estrogen does for your body?
Isn't that you're pretty? I call it my pretty. You're pretty. That's
You're
what
pretty.
it keeps the wrinkles down, the skin
Yeah.
much more hydrated.
Yeah,
It's
it
a
affects
pretty,
your,
it's a pretty hormone.
yeah, your brain, your mood, your memory, bones, heart, skin, metabolism. But yeah.
It is big
Makes
in,
you
like
great.
vaginal health. And
Yes.
that's huge. Like
It's
when you
huge.
mentioned the UTI thing, I cannot tell you how many people come in and they're like, or they're getting like recurrent like BV and I mean the vaginal mucosa just turns into like a desert and it's not lush anymore. The same bacteria don't grow there. And so without estrogen, you are more, and then also like the urethra, that tissue's not as thick either. And so it's just a lot easier to have bacteria kind of crawl up inside and get recurrent UTIs. And And then people who are afraid of hormones, you're like, well, we can just use like a vaginal hormone, that's completely safe.
Yeah.
I mean, although you just quoted that study.
Yeah,
I was like,
that was
vaginal,
interesting,
doesn't make
yeah,
any sense. I'm always like, you can take vaginal estrogen,
right.
you know, like there are just very few contraindications to that, I would say.
Because vaginal estrogen stays where you put it.
Yeah.
It's not, it
I
doesn't
mean,
like,
it's local. so
yeah,
it's
it's local,
local, yeah, and so definitely, especially for people that are afraid to take estrogen, it's like at least use vaginal estrogen because it'll make your life a lot better in a lot of ways, you know.
and now people are using it on their face.
Yeah. What?
People are using it on their face for wrinkles and really, yeah, that's like the new, and that's what I've been reading a lot of. Is
Like
people are using-
estrogen cream.
Yeah, estrogen cream on their face, yeah. Because you can buy it over the counter in Europe, just not here. For your face.
Why can't we buy yours? It's so expensive.
Why can't you buy anything here?
Some of it's not, but some of it's super expensive.
Yeah.
So, yeah.
Yeah, all right. So, and you know, one of the things that I hear a lot is people wanting to start HRT or MHC for weight loss. Does anyone think that it works for weight loss?
No.
Doesn't. Okay, so that's one of the things that I have to really just kind of put through people's head too, because they think that as soon as they get on it, they're like, well, I haven't lost any weight. I actually gained weight. Well, guess what? You might. You might. And one of the things that happened to me anyway is, you know, I've always run around 130 to 132 pounds, always. It's just that's my happy weight. Even when I got down for competitions, it was like 128. I was like, all right, that's good. That's good. I hit my weight. But when I started progesterone and estradiol last April, I went up to 138 with no other changes. And I know that probably doesn't sound like a big deal, but for me it was a big deal because you go from one, yeah, when you go from like 132 or what to 138, things don't fit. You're like, wait a minute, I didn't change anything. What's going on? So then I talked to her and I was like, okay, so I don't really like that. It's like I don't really like that. It's floaty. I don't really understand what's happening. It's annoying, but I'm sleeping better. My hair feels better. I'm in a better mood. Like I'm like, so should I care? Yeah, I care. Let's change it. So I told her, I said, I care. And she goes, well, it's probably the progesterone. She goes, let's take you from 200 to 100. So I went from 200 to 100. And all of a sudden, I started getting my period every week, which was really annoying. So then I was like, okay, I really care about that. I really care about that. I don't like that. It's constant. It's always there. That's why I was anemic before, because I was on it all the time. So anyway, long story short, I went back to 200. It went to 143. And I was like, what? I've never been 143 since I was pregnant. That's ridiculous. So I was like, all right, this is ridiculous. So as of the beginning of the year, I told her, I said, I'm coming off of everything. I'm going to start over. I'm coming off of everything. So I stopped the estrogen. I stopped the progesterone. I talked to her. She's like, okay. She goes, I know the estrogen is probably where you're seeing most of your results. She goes, but you need to have some sort of progestin or progesterone. You can't just take estrogen by yourself. Does anybody know why? They have to go hand in hand because it thickens the lining of your uterus and it can cause that can be cancer.
estrogen.
Yeah.
It'll increase your risk for uterine cancer.
Yes. So
That
that's
is 100%. That is true.
that is true. Yeah. So she's like, you cannot take that by itself.
So if you're just taking estrogen unopposed, it makes the lining of the uterus thicker, and it increases your risk for uterine cancer. So you have to have a progestin to kind of keep the lining thin.
What if you don't have a uterus?
Then you can take unopposed estrogen.
Okay.
There you go. Yep. There you go.
And the other thing is, which I know I take estrogen pill and I have an IUD. I have a marine IUD. So that is a progestin. It's local in the uterus. It just so that counts as your progestin. So I don't take a progestin, and I like it more because it's like more localized.
Yes.
To me, I don't have like all the side effects of taking a progestin because people complain about progestins. Birth control pills. It's usually they've all kinds of different progestins. Most of the estrogens in a birth control pill are all the same. The progestins change, and that's when you change people on birth control pills, it's because usually they don't like the progestin part of it. They have side effects to it, or they feel bloated, or weight gain. And then the other thing is like Depo-Provera, which people don't like because they gain weight.
Yep. Yep.
Is a progestin.
Right.
So it's usually with weight gain when it comes to hormones. It's usually the progestin that's probably the culprit.
And that's what I'm doing, is I'm switching to a Mirena ID so that I can take estrogen by itself. That's my next step, so this is my journey I'm sharing with you. So when I get back to that 132, I'll be like, guess what?
I'm like, I'm
It
gonna keep this IUD for the rest of my life.
I also have a Mirena IUD,
Mhm.
so, I mean, I'm getting a new one because it's been in like 8 years.
Yeah.
I mean, my husband's had a vasectomy and I'm not like I'm worried about getting pregnant, but
Right.
like I want the effects of the progesterone.
And that's better than actually taking progesterone? Well, I just think I mean, for me, because I've had one since I had my last, I had Reedy, my 13-year-old, so I'm just like, well, I'm just gonna keep it in now because, I don't then have to take something else.
That makes sense, yeah.
I'm 49 and I just got it replaced, so I get another 7 years, I'll be in my
I have a question for you. I'm 63. And I still have got all of my parts, but what I have noticed, and nobody has been able to help me with this, is I can't take estrogen because it gives me endometriosis. And so everything down there, I've got major vaginal atrophy.
Even if you use just the bag, have you ever just used the bag?
Suppositories, yep, and I've tried doing the suppositories. And once every 3 or 4 days, but as soon as I take it, it's like immediate cramps, immediate pain. No periods or anything, because that's all long gone,
Right.
but immediate stomach pain with the estrogen. I've tried estradiol, I've tried a little bit more of the synthetic with the suppository, vaginal suppositories, and nothing else. So I can't have any estrogen and I need estrogen. And with the atrophy, it's, I've done like the little things that are trying to help to stretch the muscles open,
Oh, yeah.
and nothing will help that. And I've talked to Teresa, we've done like the pelvic floor exercises, and I miss sex.
Right. Yeah.
And it's just, all those muscles have just shrunk, and I don't know what else to do.
Right.
How else to do?
So you've tried all the different kinds of the
Estrogens.
rings,
Mhm.
yeah, I mean, the only.
I'm looking for answers and I just don't know where
I
else to
mean,
go.
Yeah. I mean, it surprises me because it's been so long without estrogen, you would think all those endometrial implants should be burnt out, you know what I mean? You said 63? Yeah.
And I think I ended menopause probably at maybe 57, 58.
When's the last time you tried it?
Oh, I'm just on it, yeah.
Okay.
Yeah, I mean, we've been trying to do things, and again, I've been trying to do the suppositories. It's like 1 every 4 or 5 days that I can do it,
Right.
but I take it and I have the issues, and then I wait a couple of days and I try taking it again. And it's like, with my little muscle manipulator, I try to do that. And it's like, maybe this is a good size as opposed to my husband before, which was wonderful.
Yeah.
This
Have
is-
you tried any of the other products? Like there's like hyaluronic acid?
Yeah, the hyaluronic acid, yes.
Or
That
what
makes
about
it
the-
easy just trying to get right to here, but when you get to a certain spot,
It doesn't.
everything is just closed in.
Yeah.
Nobody talks about the atrophy.
No, I know, they don't. I mean, people come to me all the time and they're like, what's wrong? Something's wrong.
Yeah, it's not just the dryness, it's the
Yeah,
complete
nobody
atrophy.
brought that up.
Mhm.
Yeah. They think they're alone.
I'm
Do you
interested.
have a do Yeah.
Yeah,
I would even message Dr. Reyes about that, see if she has any ideas on that too. I'll send her a message on that.
thank you.
I mean, I don't know, it seems like a hysterectomy would be kind of aggressive, but I don't know if that's, if a lot of endometriosis is
Away.
on those surfaces, it depends, because you can have endometriosis implants other places.
Yeah, my friend had a full hysterectomy in her early to mid 30s and she still has horrible endometriosis and she cannot do the suppositories at all. She gets horrible, like out of work for a week, horrible.
So where does she go?
Live in pain. She's got an appointment at Mayo Clinic in a couple months. Because supposedly they can find she just had an MRI not that long ago, a couple months ago. And they didn't see anything, but she's in horrible excruciating pain, constantly going to the ER. Just seeing pain management doctor, like the whole thing, it's just ruined her life, the endometriosis, so. She'll do anything, and she doesn't even care anymore about like hormones or lack thereof, she just wants like the pain to stop, and she can't even get to that point.
I only have the pain
Despite
when I
having
take
a
the
full
estrogen.
hysterectomy, ovaries and everything gone in her early 30s.
Wow.
I will definitely send her a message and ask her about that, because that's not something I've even heard of, honestly. I mean, it's besides the video, like just talking about it, but as far as the actually without with trying all of that stuff too, she probably would wanna ask you some questions. All right, well, anybody else have anything to share? No. One of the things that I've been really wanting to talk to everybody about too is who is having enough protein in their diet. What? Because one of the biggest things with this time in our life is sarcopenia, muscle loss. And and that's another big discussion we have pretty much on an hourly basis is weight training. And the biggest thing I see people do too much of is too much cardio and not enough weights. And the biggest complaint I have is they're trying to lose body fat, but they don't want to get big muscles, which always surprises me because it's so hard to do that. If anybody's ever done a fitness competition, it is so hard to get big muscles. Like it's not something that you can just like do in a couple of weeks by lifting 5 pounds heavier. But you know, women do lose 3 to 8% muscle per decade, and then more after they turn 40. And so resistance training is a huge important deal for that. You guys have seen I've done on the classes on Thursday and Friday mornings. I'm trying to encourage you guys to lift heavy, count your reps, stop going for the timer, because you have to lift heavy enough to where 10 reps is pretty difficult. And if you can do 12 to 15, you're not lifting heavy enough. And I know that I encourage you guys all the time to eat more protein, and some people overdo it. And some people just are saying, how do you even get 80 to 100 grams of protein in a day? Which to me is not super challenging to get 100 grams in a day. But how many of you think that you get at least 100?
I don't even see how you could digest that much protein.
She's one of my girls. 1, 2, 3. Okay. 4. All right. So about 4 people out here. So
I get 80.
you get 80?
Yeah.
Okay.
But it's hard to get to 100.
It's hard to get to 100. So we're gonna say.
Oh, no, I'm just gonna say.
You get, she's like, I definitely get that. So one of the things that I was gonna encourage you guys, if you've never had a in-body scan or a body fat machine scan to kind of figure out what your lean body mass is, that's super important. I have a cheap bioimpedance body fat scanner I can always do for you guys, and I'm not because I want to know what your body fat is, because that's not what I care so much about. I care about your lean body mass, which is a calculation you can do. Melissa has an in-body scanner at her facility, which is a little bit more in depth. None of it is 100% accurate unless you're going underwater. If you do it hydrostatic, that's 100% accurate. But these different types of scans are great. And this one, if you can figure out what your lean body mass is, you need to eat a gram of protein per lean body mass. Not ideal lean body mass. Exactly. So if you're like, if you're trying to, I don't believe in everybody needs to worry about a certain number on the scale ever, except for me with my 132. Except for me. But that is, I was like, not me. Except for me. But no, like if you know around where you want to be and if you can figure out what your lean body mass is now and figure out, are you even eating enough to support it? Because most people aren't. I would say, gosh, out of the food journals I've seen, I would say it's in the low 5 to 10% of people that are getting enough. They always think they're getting more than they are. And then I say, let's track for a week. Just a week. You don't track it every day. Go ahead.
Is there a certain amount like that you have to stay under per meal so that your body can like digest it? It's like, oh no, I've only had 10 grams, I'm gonna have 90,
So
for dinner.
back in the day of, bro diets and what, it was always thought that you can't digest more than 25 grams of protein at a time. I have read several studies where that's incorrect. I will look up the latest ones on that but the last one I read was that up to 40, is digestible. And I don't know if you guys have seen anything differently.
Yeah, I don't know the answer.
Yeah, the last thing. What were you gonna say?
So I'm like, some people eat like 50 in a meal, like if you have a steak, you can get 50 grams of protein like that.
You can, so,
Well,
and
that's-
I do believe, just like everybody's body is different, you're gonna digest different, everybody's body is different, but the books say that, you know, you could digest 40, 45 grams of protein at a time. There's a lot of women out there that are in the nutrition field that constantly are pushing women to have 40 grams of protein per meal. So that is very hard to do, just to have that without processed protein. You guys know that if you're trying to hit your protein, I will say this sounds super eating disorder-ish. So I'm just gonna preface that, but it's not. Most of you don't know what four ounces of protein are. If you look at your hand and I tell you to eat your palm and protein, some of you guys have smaller hands. So I've seen enough food journals and enough pictures of food to know that someone will tell me they're eating 5 ounces of protein and then they show me a picture and I'm like, that's at least 2. Go weigh it. And then I'll have them weigh it and it's always 2 or 3. And they're like, oh, I thought that was 5. No. So if I'm telling you, get a $7 scale on Amazon just so you know what it is. Because you'll probably be surprised. A lot of times the chicken breasts or whatever, if you get some chicken breasts, a lot of times they'll be those humongous ones. And you might get 8 or 9 ounces in one chicken breast. Cut it in half or, 3/4 of it, because you can overeat protein just like you can overeat anything else. And you don't want to, if your body doesn't digest the calories, regardless of whether it's coming from protein or carbs, whatever, it's going to store it. So if you're eating too much of anything, it's going to store it, and you're not burning it the way you want. So you can be eating 160 grams of protein, that's awesome, and not be able to lose weight, not know why. So you have to realize that too much of a good thing is a bad thing too. So, but I would say more than anything, find out what your lean body mass is if you don't know. I can do it. Melissa can do it. She also has some pretty cool tests at her thing. We did a grip strength test. You guys know I always try to get you guys hanging. But she has a grip strength test, and I was really mad because I was average. I thought I was like, oh, I got this one. I do kettlebell. I got a bar carry, so I could hang for a long time. I was average, so I want to see if anybody's above average in here. That'd be pretty cool.
So
Do
it's a
grip
good,
strength.
so grip strength is a really good indicator of overall your whole skeletal muscle health. And studies linked it to decreased mortality if it's low. So I check it on every patient once a year. And it's pretty striking. Like I did not expect yours to be
I
average.
know, it was annoying.
I was really shocked.
Yeah, I was really shocked too. I'm like, have you seen me do the monkey bars? I'm really good.
But it's even like people I never, or like arthritis can affect it, and then certain people favor certain hand, that'll be stronger. But
Yeah.
it's a good look at overall skeletal muscle health.
Yeah.
And then you look at that, like, so that you kind of want to go based on your ideal lean. You don't want to eat based on what you are now if it needs to change. But you want to know what it is, but you want to eat to what your ideal is.
Yeah.
And
And if
the
you're
difference between that and like a bone density test.
Bone will look at just bone density, a regular DEXA, unless you get
This
the really expensive DEXA. But a regular bone density is just bone. Mine tells total body water, fat, muscle, all that. But it doesn't have bone. That would be a difference.
just talk to her. Yeah. I think she'll do that. So what were we gonna say? I thought you went.
Question on fasting and
Yeah.
hormone disruption, because I've heard sometimes too, how people say fast, or very frequent, right? And so, but then I've heard you gotta be careful with that. It'll disrupt your hormones.
Yeah.
I don't understand if you should or if you shouldn't.
I've read Dr. Mindy Pell's book, Fast Like a Girl, and then I've read all the studies saying that fasting is not great for women in perimenopause. And she's saying yes it is, and they're saying no it's not. I believe that everybody's body is different. What works for you, not gonna work for you. And I think if you want to try it, and if it works great for you, awesome. But I've read too many things where it is a hormone disruptor. I personally did try to do it, and I thought I was going to eat my arm off, and I'm like, that's not working for me. I'm not doing that. I just,
She says, like eat based on your cycle. and that, you should have more carbs certain times of the
Yeah.
month and not fast during a specific week. I can't remember if it's the ones leading up to your period or whatever, but if you don't have one,
I know, then she tells you to fast by the cycles of the
That's
moon.
what I was thinking. What happens if you don't have one?
She says, go by the cycles of the moon. Here's what I know about everyone, you're not gonna do it if it's not easy for you. You're not gonna do it. If you have to go out and go, what moon cycle am I in right now? Should I have more carbs today? You're not gonna do it. You're just not gonna do it. It has to work for your schedule, for your life. It has to be easy-ish for you. And if fasting works for your schedule, awesome. If it doesn't, awesome. Find something else. I think the biggest thing I've always seen work for people always is to increase their protein, have moderate carbs. Do not go no carb.
I agree.
The people that go keto and low carb, like super low carb, are the ones that have the hardest time and that their hormones are really messed up. That's just my experience. That's what I've seen. And I've seen a lot of people. And it's so hard to maintain.
It's like you need energy to like work.
Yes, and the people that don't have enough carbs in their diet, a lot of times that really messes up their hormones. So
It's hard, look, I have celiacs,
mhm.
so it's very, it's a struggle to like find. Like, eating has becomes very complicated,
Yeah.
and you're overthinking everything all the time.
Yes.
And I think what happens is you just kind of stop.
Stop eating because
Stop
you're like, I
eating.
can't. I
And you
can't
just don't
eat.
bother anymore. You're like, this is just too much work.
It requires a lot of preparation. Amy's husband is too. Yeah.
It's very, it's just becomes very, very, very cumbersome, and you feel like it's embarrassing too. Like when you're out with people, you're trying to like,
And they're like, oh, she's not eating that because she's so skinny.
yeah.
Right.
They
Yeah.
think you're being trendy.
Yeah.
Yeah.
You don't want to talk about it. You don't want to like ask the waiter. You're trying to kind of like whisper,
Yes.
you know,
Yes.
because you're like, I don't be that girl. But it's like it truly makes you really, really sick.
Yeah.
So
Yeah.
it's hard, like when you're trying to like figure out what to eat and what not to eat, and then you've already been through menopause like 7 years ago, like 42, 43. Wow. Yeah, I was really young. So it's just really hard because like you go to a doctor and they're like, oh, we'll eat more carbs or take this or take that, and you're just and I have IC. So it's like just forget about it. Like there's just so many things.
So many things.
Eating has become work. The older that you do get, it's like when you were younger, it used to be so much fun to eat. You could eat anything, not
Yeah.
think twice about it.
Yeah.
But the older that you get, you're in your 40s, in your 50s, and you start getting into this. It's like it just feels like that's all you're doing is thinking about.
Oh, it's like
Yeah,
exhausting.
we have flow chart.
That's all you're thinking about
Yeah,
all the
food
time.
prepping
Did I
and
eat? Did I not eat?
grilling, and like last night I spent like hours making chicken. And I'm just like, oh my god, this sucks.
The one
You don't
so
eat meat, and how am I supposed to get as much protein as you're saying without processed protein and no meat? Like it's
I will
impossible.
tell you, I went vegan with Brianna for 6 months and it was very difficult because I was eating a ton of chickpeas and I'm like, that's more carbs than protein, but it's got the protein in it. And I was trying to eat without eating all protein powders, but I had a really hard time doing it without protein powder.
It's not a moral thing. My friend worked for Purdue and Purdue Chicken, and after hearing everything, I can't.
I really do only buy organic chicken because
Purdue has organic too.
well, you gotta know which brand you're going for.
What percentage of protein powder is okay to eat in conjunction with regular food?
I mean, I personally would recommend people not eating it more than once a day if you're gonna do it. Yeah, because it's just there's just so much. Well, you will eat very clean protein powder. I know you probably eat whatever Jess is telling you to eat, but like it's so much junk in the protein powders, and it's just so processed. And there's so many protein powders that have high levels of arsenic.
So just
And
like your breakfast
lead.
and then worry about other things.
Yeah, I would just really eat your protein. I would try as much as you can to stay away from the protein powders. But I mean, if you have a shake a day, I mean, you know, how many? I find that people are so worried about ingredients and protein powders, but then they're the first people that go and get their Diet Cokes or they go and grab their bags of chips. I'm like, okay, eat the protein powder. You know what I'm saying?
Yeah.
So I just feel like, you know, if you're gonna have your protein powder, just get one with as clean of ingredients as possible. I got a really clean one linked on Amazon that's super clean.
It's so good.
Yeah, it's super clean. It's that Levels brand. It's pretty clean. And then I got clean, simple ingredients. It's a brand new one. It was super low. Yeah, I just thought it was a pretty decent protein powder. But I would just be like trying to eat the vegan thing. I can give you some great vegan recipes, but they are so much work. So much work. But I think that the biggest thing you guys can do is stop prepping too much. The thing that I find that not you guys, but most people when I'm doing food journals is they tell me that they just don't have time to meal prep. If a meal prep takes me more than 30 minutes, I don't do it. Every single Sunday, I'm a very regimented person. She's known me since she knows. I am very regimented. I'm like, this is what I'm eating at this time. But that's just my whole life has been like that. And I think a lot of it had to do with doing, honestly, fitness competitions for so many years. I would like always pack in my food. I mean, I shipped frozen food to Vegas in my suitcase because I wanted to be defrosted by the time I got there and I could just put it in my fridge. I mean, that's how my brain was, and I was so regimented that way. And for me, like I go grocery shopping every single Sunday, and I immediately set aside exactly what I'm going to cook that day because I'm going to have a certain amount of chicken just to last me till Wednesday. And I make a big thing of veggies to last me till Wednesday. So I make it from Sunday to Wednesday, and then on Wednesday I cook for Thursday, Friday. I see people that do like the 5 days a week and they're having the exact same thing every single day. I'm like,
Food doesn't stay fresh.
yeah, it doesn't
You
stay
gotta
fresh,
freeze
number one. Yeah, or you have to freeze it. And it's so much work that you tend to talk yourself out of it. So I just think you need to make it as easy as possible for you. And I do have a ton of recipes for vegan and vegetarian if you want any. I have a ton of them, books and books and books, but they are so high prep that when Brianna moved to New York, I'm like, she's cooking for herself.
Yeah.
It's great because and now she eats tacos every day. But she makes herself tacos every single day because it's easy. And I'm like, oh, it's hard, isn't it, to chop up all that stuff? But yeah, so it's very difficult, but you always will make time for what's important to you. Always.
Where is everyone go? Like everyone's doing all these different things. Are they going primarily to a primary care or to their gynecologist?
What are you guys going to?
Cash pay primary.
Cash pay primary. So I have found like my primary is awesome, but she didn't know anything about hormones at all. And so I told her all the research I had done, and she was like, oh. She was writing it down, and she goes, whatever you want, I'll just prescribe for you.
You
And I was
know
like,
what you want them to prescribe,
Yeah.
primary care will suffice.
right.
But you have to tell them what to write.
Right. So you have to be your own advocate and learn. So the reason I started going to Dr. Ray is because that's what all she does. She's, a
I
pretty
think you could find, I mean, either primary or gynecologist, I think you just have to preface it by saying, hey, do you do HRT?
yeah.
Or, are you,
Someone
because
might do,
I was looking, I mean, the practice I was in, everybody did HRT. It wasn't like, but it is, so when I was a resident was when the WHI study came out. Like that was my first year residency is when the WHI study, which is the one that she was talking about.
Do you guys all know what that is? Okay.
Yeah, the
Women's Health Initiative.
Yeah, and so that's when everybody like off hormones are bad. It was back and forth, and then like it's the pendulum has definitely swung the other way. But I would say just ask your doctor. I was just talking to one of my daughter's friends' moms, and she was saying that she sent me a list of her labs, and she was like, I went to my doctor because I'm having all these symptoms of menopause, and is anything on this lab slip like related to menopause? And I was like, well, no, not really. I mean, she's kind of ruling out other things because there's a lot of things that can cause these symptoms, thyroid issues, lots of things, anemia, and there isn't really a great test to say, yes, I'm in perimenopause, because maybe the day that they tested your blood, you ovulated a week ago.
Yes.
And so your labs are normal. I mean, if you look at the female hormones during one cycle, they're all over the place. So the only way you're gonna know it is if you catch it when, your hormone levels are low. And that's not always the case. And that could be years and years of you feeling crappy, but your labs are normal. So, but there wasn't anything, there wasn't an estradiol, not FSH, nothing on her lab slip. So like, she
Mine
was
were all
like-
normal too. Which is,
Yeah. But
Yeah.
she wasn't even getting it checked.
Yeah.
And the doctor didn't even add it to it. And I was like, well, I mean, technically, yes, she should probably check this too.
A very good doctor that I've gone to, and I see him part-time in conjunction with my primary care, is Brent Hagan. He's on the north side of Countryside Mall over by where Kohl's is, across the street from Kohl's. And he is amazing when it comes to hormone therapy, anti-aging. He is so health oriented. He's very, very specific. He is a fee for service. He's not big on insurance. He's a fee for service, but he's not one of these walk-in. You usually have got about an hour, 45-minute appointment with him. He just pays attention to what you want and what you need, and he is amazing. AGIN.
Yeah, I think because this is cash pay, that it's lucrative, so lots of doctors and practitioners are just jumping in,
Yeah.
like the med spa and
Yes,
stuff
a lot
like
of
that,
nurse
so-
practitioners.
My
Yeah,
So
primary,
you have
she
to
sets
be
a
very
time-
careful.
my primary, she sets a timer, 15 minutes, comes in, 15 minutes.
wow. Yeah.
She used to be great. She used to be great like 7 years ago when I started with her, because she's wonderful. She's Western and she's got a holistic doctor, and they come in like Thelma and Louise. And they were wonderful when I first started with them, but because their practice has gotten so big, it's horrible.
Well, I think if you guys have one that you love, if you wanna send me their information, I'll put it on the list and give it to all you guys, if you wanted that. You know, I love my Dr. Reyes, I love her, you know, I love to ask Jenny questions every second. I'll ask Melissa questions.
They go, oh, you shouldn't take hormones, that's dangerous. I mean, then you should be like, okay, well, I need to talk to somebody else then.
Yeah.
That's not the.
My gynecologist that I've gone to since I had Brianna, you know, I love him. I trained his wife right after she had breast cancer, so I'm very close with the family. But when I started asking him questions, he goes, "You're fine. You're in your 40s. What do you expect?" I was like, "Oh, okay, thank you, next." But I'm still going to him because I love him, and I now
You can do the breast smear, but.
yeah, I mean, you can do that, but that's about it. And
They
so
do
that's,
make you feel that way.
yes,
Because it's
yes.
kind of like, well, you're this old and you have grandkids, you're running, you're running a business and you're a mom and a grandmother and all these things. They're like, well, of course you're tired.
Right.
And you're like, well, I don't think I should be that tired. You're more than normal tired, but they make you feel crazy. Like,
Yeah.
why are you even asking?
Right.
You're,
Don't go to a man.
of course you're tired.
Easy fix.
I got to do
My movie put me on an estradiol, but it was so low, and I was on it for about 6 months. I'm like, nothing's changing. I'm horrible, and you know.
And then you use
and then
Midi
I
Health.
did Midi
Yeah.
Health.
You guys know
and
about
I
that?
Really liked.
They take insurance.
Yeah,
they're
they take
online.
insurance.
MIDI.
MIDI.
Yeah, Midi Health is that's a new thing that you can go to midihealth.com and you can book an appointment with one of their professionals, and they take insurance, which a lot of these places don't. So if that's like super important to you, definitely, you know, check that out.
So it's all virtual?
Yeah, you meet with them and
Yeah.
I sent her all my blood stuff, like.
Yeah. And do they send scripts to your labs?
Yes.
Yeah, they send
Yeah.
scripts and your insurance covers that. My insurance covered all my labs.
I feel like it's also pricey, and
Yes.
I'm on a high
Mhm.
and then I just had my second one, and she was like, "How is this going? What's this doing?" And I said, "I need more." But she did bring up testosterone as an option. Like, let's see how this next 3 months goes.
Right.
But then I went back to my OB. This is what I'm taking now, and they were good. And then they recommended supplements, so I don't know who's on what. Like, I'm taking magnesium.
Yeah.
I'm doing this. Like,
Is everybody taking
whatever.
magnesium?
Oh, yeah, best.
Yeah,
Glycinate.
I mean, magnesium is like, most people are deficient in magnesium, and
Yeah.
magnesium is super helpful if you're having any hard time to go to sleep. Not for people have told me that it doesn't really help them go to sleep, but I take
Mhm.
magnesium every night before I go to sleep, and there are several different types. I take one by Bio Optimizers that has all of the types in it, and I just kill all birds with one stone. So, but I take 2 every single night before I go to sleep, and if I run out of it, I'm like freaking out that so I now order 1 extra bottle every single time, so I never run out of it. I ran out of it. Oh my gosh.
Yeah.
I remember when I had to leave my house for the hurricane, I was like, my magnesium. I was like so worried about my magnesium. I'm like, I don't care whatever else happens.
I might die for finding it.
You get that for
I was like, when do you swim? I gotta go get
So big, I'm always choking on them.
really? See, mine's a little tiny capsule.
Mine are
Yeah,
capsules, yeah.
mine's a little capsule, yeah.
I need to switch.
You switch brand. But yeah, magnesium is huge. Does everybody take D3, K2?
Yep.
Yes.
Okay, that's a big one. If you don't take that, you should definitely start taking that. Everybody get your blood levels checked every 6 months.
Yes.
Okay,
Or-
so your B12 tends to go down a lot, so you should probably supplement with that if you're low on it.
What's the brand of magnesium you take?
Mine is called Bio Optimizers. I actually use a discount code from a podcast I listen to, and it works every time. I can find that out for you and share that with you. I think it's like 20% too, so it's a good discount. What?
Claire. KLAIR.
You get yours from Claire. So, I mean, everybody's probably got a brand that they like. And then everybody on a good multi.
Does
No.
Target brand stand?
Every scientific study on multivitamins suggests it's just expensive feed. I've not read a single one.
I will
That has any
disagree
benefit.
because my blood work shows mine's working. So I have to take
Working
it
for
every
what?
single day. Working for different levels of like my B, my D, my iron, I get everything.
I meant like it changes in your life or
I
lifespan.
just looking at blood work.
Yeah.
Yeah, just looking at blood work.
What's a
But
big B complex?
I took a Pure, that brand Pure.
Encapsulation.
Yeah, Pure encapsulations. And
Stuff's good quality.
I do a methylated vitamin because some people were gonna say, I was gonna say, yeah, some people, I don't know if you've ever done gene testing, I don't know how many feel about this, but I know that I have what's called an MTHFR gene.
So do I.
You do that, and so if you do have that, you have to take methylated vitamins because your body does not absorb them.
And your body can't methylate.
Yeah,
the B, and you can't make like certain.
So then it would be really expensive
like
feed.
that.
Yeah.
So it's not
Yeah.
really good.
So, do you think?
I have two gene mutations. It's like 30% of people have
Yeah.
that MTHFR mutation.
I have one gene mutation for that.
I was
They
gonna
call it
say,
the
but some of
motherfucker
them
gene.
still have-
Yeah, they do. I have MTRR and MTHFR. And so there's lots of different genetic, what do they call them? I forget, I'm drawing a brain.
Mutations.
Mutations,
But you
yeah.
have to see, so a lot of those gene mutations don't matter, so you
Right.
can try a methylated B complex, see how you feel. I feel horrible, so I actually take a different version of the Bs.
Yes.
Even though I have like.
I also
alleles
cannot take a
of the
methylated B
MTHFR.
complex. It makes me sick to my stomach.
Yeah, so
Yeah.
you have to try and see, because you might react differently.
Is it typical with a B complex like that, a methylated, for your P to be like vibrant?
Yes, it's just a filler, and it's more expensive.
Yeah.
You just gotta see how you
Bright
feel.
orange.
Yeah.
Test
Yeah.
it out for a couple months, see if you notice anything. You might need, there's like 3 versions of B12, so you might not do but good on the methylated.
And this is just, every single body is different. Like what hormones work for you are not gonna work for me. Some people, when I've been asking, how much progesterone are you on? Oh, I'm on 200 and they've not gained 8 pounds on the scale. That's not fair. I don't like that. So it's just like different. Everybody's so different. And that's why when people ask me about diets, like even with the fasting thing, I'm like, what works for you is not gonna work for you. So, and everyone's so different as far as their daily schedule. Not everyone is like Tony, who is working out at 4 o'clock in the morning and then runs and works out again. And then, and some people are sitting all day long for their jobs, which, it doesn't do them any favors. They gotta get up and do some movement snacks during the day and wake their bodies up a little bit. And so fasting did terrible for me and I hated it. And maybe it did terrible for me because I like to eat a little bit. I can't just wake up and not eat and be starving. I would not be a nice person to train with at 6, 7, 8, 9.
But Americans can fast for like 12 hours.
Yes.
Like, if you stop at 6, you can wait till 6.
Yes.
That is a fast, and
Yeah.
that's what we naturally should be at least doing.
Yes.
And then women can do like 2 days a week. You could maybe go a little bit longer, like 10 a.m. eat. That's not gonna mess you up. That's called cycle fasting.
Yes.
So like 2 days a week, you can go a little longer, but don't go like all day.
Yeah.
But
Which a lot of
12
people
hours,
do.
you should do that every night anyways.
Yeah.
I feel like that keeps me from like eating at night too.
Yes.
You know what I mean? I'm like,
Yeah.
okay, well, if I want to eat tomorrow morning, then
Yeah. Exactly right now. But I do have people that work, I have a lot of people with different schedules. And sometimes they work night shifts or sometimes they work, till 8 o'clock at night and they're like, I haven't eaten dinner yet. I'm like, eat dinner, don't, and then have your, breakfast a little bit
I
later.
noticed I don't sleep well. I don't eat well at night. It's like I'm hungry in the middle of the night, and then I'm awake. I'm like, I need to eat in the middle of the night.
Yeah.
I
Don't get up
hungry in
and
the
eat.
middle of the night.
Yeah, I'll do
Yeah.
a scoop of peanut butter.
Yeah.
Don't choke to death on it.
I thought it was doing really well
did
by
not.
eating like a couple of those little mandarin orange cuties, and my doctor's like, oh my God, right before you go to bed, you know how much sugar that is.
Oh, yeah.
I thought it was doing great because I'm eating my oranges and.
You like that too, my friend?
Right before we go to bed, that's too much sugar.
Yeah.
Great.
I want 2 glasses of wine before bed. How's
Yeah,
that?
that's fine. I mean, if you want to do the non-alcoholic one. Take Yeah. Do anybody have any questions for anybody here that you think maybe they'd help you with? You didn't hear. No.
For people who have been on therapy for a while, how long did it take before you started noticing changes? When you started with
Progesterone took like a week.
The
Well, what do
only
you
change
feel with
I ever
progesterone?
noticed was like taking progesterone, because I went from literally not sleeping to sleeping. Aside from that, I've tried testosterone, estrogen, estradiol. I noticed nothing. The only change I noticed was from progesterone, and that just comes from having insomnia and then not having it, which is pretty staggering, like, change.
I would say the brain, me, that was I actually had an MRI in my brain. My first husband died of a brain tumor, so that's part of it, but I was like, I thought I was having like a seizure or like some kind of, I was like, what's wrong with me? I couldn't remember numbers. I was like having just these episodes and also night sweats. And as soon as I started taking estrogen, I would say like 2 days later, I felt immediately different. Yeah.
The brain cell. count.
Okay, I saw that you want phone number, so I'll make sure to share that for sure. If anybody has anything online that they want to say, you can say it. I'm looking.
I can't words.
I was gonna ask if anybody's looked into natural, like black cohosh or red clover for estrogen, progesterone.
Oh, say that. Did you guys say that again? Was that Letitia?
Yeah.
Hey, Letitia. I went to high school with Letitia. Letitia, say your question again.
I was wondering if anybody's looked into herbal plants like red clover or black cohosh or all those kind of different ones for night sweats, anxiety, and hormonal estrogen, progesterone instead of the treatments.
That's in the book. It is. It's in the book. Go ahead. Has anybody tried that?
It works. It works. It's so good.
Okay. Has anybody heard of that? Can you write that in the group?
I can write that.
Yeah,
Yeah,
write
I'll
that in the group. Yeah, put that in the group. Interesting. Anybody else on there? Want to say anything? I know we've only got like a couple people left on here. I think everybody else dropped off.
Is black cohosh, and what was the other thing?
Black cohosh, and say it again, Letitia.
We found the microphone.
Yeah.
There's red clover, there's black cohosh, there's guanhogue, there's evening primrose. I mean, I've got a pill that has got a whole bunch of them, and if I don't take it, I mean, I have night sweats, anxiety, all emotional. But as soon as I take it, like that night, I have no problems sleeping. It's great. It's incredible.
She said, please put that brand in the group and then put that in the, put whatever you're taking in there just so we can look at it. That's interesting. Thank you for sharing that.
Yep.
Anybody else?
So for the people who have the IUD, do you feel the progesterone systemically though? Or are you only taking it for the period change?
I started taking mine for the period change.
So you're not getting like the help with the sleep or anything?
I wasn't, but
You're not feeling it.
I'm on
Okay.
Kylena, because it's a lower dose of that, which is why I have to get it out and get the Mirena if I want the progestin to be able to take the estradiol again.
See, I never read that, and you told me that the other day. And
Yeah.
I've never read that. That it makes a big difference, but I guess I would have to look.
She told me it was the amount that was in
It
there.
is true. The
Yeah.
is lower.
So she said, once you get on Mirena, I'll give you your prescription again. I was like, okay. So to answer your question, for me, the progesterone, even though I hate it because what it, whatever, it was for me immediate. Like when I went, like the second day I took it at 10 and I was asleep at like 10:05 on the couch. I was like, what is happening? Like so I started taking it when I went to bed because it made me that tired. The estrogen kept me asleep throughout the night, where I used to wake up in the middle, and the estrogen is, from what I've been told, that's what kept me asleep in the middle of the night. And I did notice my eyes did not water at all, almost immediately, which was weird because I went from almost going through a box of tissues and a couple of days from wiping my eyes.
You're back at it.
Yeah, I'm back at it because I've been off of it. So every single morning when I'm coming in here, it's starting again. I'm like, that's annoying. And so that, and then my hair is super thin. My hairdresser was like, what's going on with your hair? Did you change your shampoo? I'm like, yep. That's what I did. She's like, it's super thin. So like, I did notice that those are things I noticed on it.
I'll trade you my dry eyes for your watery eyes.
Yeah.
But the dry eye is why it's watery. That's what the doctor told me.
You know what, you can help with the dry.
Really?
eyes,
Yeah.
is,
Mine never water.
So she said that you could either be like where you have to put drops in or they overwater.
Oh, mine, I have to put drops in. I have to sleep with drops under my pillow, right?
Try fish oil, because I got like right at the 2 o'clock position. And they get so dry, and I thought I had ulcers in my eyes for the longest time, and they're like, no, and as soon as I went back to my fish oil.
Taking it, not putting it in your eye.
No.
right?
Alright.
Yeah, well, like, she's like, it's usually because I forgot to take my fish oil, and you take it one morning and one at night.
Right now, thank you.
Yep, that definitely has helped me.
I wanted to get you guys together just so you guys could share your experience. And I don't know if this has been helpful for anybody, but I'm not gonna be getting a talk on hormones because I'm still going through my journey with it too. And I just love that book because it has answered every question I had. So I definitely recommend you guys read it if you haven't or listen to it.
And it's a good, she's a physician.
Yeah.
It's she quotes all the randomized controlled trials.
Yes.
And it's very scientific.
Yes. The last 7 or 8 pages is just quotes from every study and research.
Yeah. She's got all the data in there.
And see, that's the only thing I'll look at now. You can't read anything online or on websites. If it's not an actual double-blind, placebo-controlled, randomized study, whatever, don't even bother. Don't believe anything that they're saying because it's just blatant lies. Right. It has to be a real scientific study.
And that's why I like her because I feel like she's very good at that. So my biggest thing I wanted to do is talk about it because I feel like people whisper. And we tried that. I'm like, why are we whispering?
Right.
Everybody's going through this. So let's not whisper. I mean, I'm very much an open book. As most of you know. Did I tell you all the THC drink story?
Has
Hey,
anybody
most of you have heard the
Yes,
story?
yes.
Before I forget, has anybody tried a GLP-1 for hormones and did it help?
What's the deal?
Like the Ozempic or whatever, did it help hormones, hurt
So
anything?
I've been on it for 11 weeks, like since I started the pellets in January. And I've lost like 15 pounds and I feel like a completely different person. But I think it's a combination of a thyroid medication that I changed to the GLP-1, which is microdosing. It's like the very lowest amount, and the pellets. It's the combination of those three.
What was the thyroid medication that you switched to?
NP thyroid.
N as in Nancy, NP?
Mhm.
I never heard of that one. I'm on Armour.
What's the microdosing?
Take that, and I really like NP thyroid.
So
Yeah,
yeah,
I've been on 3 different kinds, and that one is by far the best.
And then we can change the dose whenever I feel like my readings are
Mhm.
easier, like just cut the pills, it's easy.
Yeah.
What were you gonna say?
So GLPs help hormones indirectly by they prevent insulin resistance. So insulin resistance is going to affect your hormonal axis, right? So when you're preventing that and treating that, those will naturally improve, right? Like your cycles all of a sudden come back. So I always tell women, you're gonna get pregnant, you now need to prevent that. Your periods are gonna come back if you have PCOS or any of those things that help. It doesn't necessarily give you them back, it just helps them balance naturally because you have less fat tissue and less insulin resistance.
And from what I understand, and I'm not as educated on the GLP-1 microdosing yet. I'm reading a lot about it because I know so many people are doing it. And the microdosing is different. You asked what that was. Than the people that are getting Ozempic for weight loss.
Yeah.
They're getting those dosages.
A lot of people are taking way more than they even
Yes.
need to because they don't know any better, but the microdosing helps with inflammation,
Right.
like I have Hashimoto's.
So
and,
do I.
like, yeah, but I've not had one single side effect. If you asked me like how I feel from being on it, I don't feel any different at all.
And the people that are doing it for weight loss and
They're like diarrhea.
oh my
throwing up,
gosh,
can't
it's really
breathe,
bad. I do have a lot of clients that are on it and it's the
1.25,
side effects
so
are crazy.
6.5 units of tirzepatide.
Who do you get it from?
So I went to a nurse practitioner. I actually almost started this process. I did start this process last summer. And then I had 2 surgeries back to back. One was planned, the second one was unplanned. And I almost couldn't have the second surgery because I had taken 1 dose of tirzepatide. And then I freaked out and I was like, I'm never doing that again. Because if you have to have an emergency surgery, technically you're not supposed to be on it, even though it was such a small dose.
What does it do?
It delays the
Stops the
emptying of
gut.
your stomach.
Yes.
So you're not
It
supposed.
delays the emptying of your stomach, so you have a ton of undigested
Yeah.
food in your stomach, so it's problematic for emergency surgery.
So I started, but then everything got better and I recovered. And so then in January, I found a different nurse practitioner that wasn't charging me $350 a month, which is insane, but that was for everything. That was for progesterone, testosterone, a different type of thyroid medication, plus the microdosing. So I found this other lady who did the pellets. I ordered my own vial of tirzepatide compound and I inject it myself every week. And the NP thyroid is like $45 for 3 months. So she doesn't like nickel and dime for everything. But her name is Sherry Rivera, but she's a nurse practitioner. So I know a lot of people that are nurse practitioners are kind of doing that, but she's been doing it for a while and I have other friends that have been to her for thyroid stuff and she's good. She reviews my labs every, I've done them twice now since January.
I have a question to the doctors. What are your opinions of PAs and nurse practitioners recommending certain things or? I know you guys always want to be in charge, but what is your opinion on that?
I mean, I think as long as they have the appropriate, training. I'm not.
Yeah, same. I just see a lot of, so I'm obesity medicine board certified. So sometimes I have a problem with, all these little med spas and they're like, oh, it's wild, and I'm like, like they don't, again, they're not board certified.
That's fine.
So it's like, it's hard for me and some of them are really good. I don't work with any now. But it's kind of hard because there's not a great,
I
like,
think if they work in your practice.
Right, and
we do like
Yeah,
this,
your
we've
philosophy,
had like
yes.
midwives that I work
Right.
with and like their
Right.
practitioners and they're like,
Yes.
there's a
know,
hard time, like,
yeah.
they don't go through the same, like, constant board certifying process, constant licensing. It's not the same, so they might be good, but we don't really know.
Right.
So
Gamble.
it's a gamble, and that's scary for me when we're working with those type of medications that can be very dangerous.
Mhm.
Even hormones, it can be.
You don't wanna guess.
The other thing I would say about hormones is there are some places where, so basically the right dose of hormones is the dose where you feel good. You know what I mean? Like, there are, I used to have these patients that would come in, they were going to somebody, and if you're not feeling good, then you should have them checked. You know what I mean? Like, if you're on something and you're like, I don't feel any different, or you're like on testosterone and you're like, I feel really weird, definitely needs to have them checked. But when it's something where you're going every week, they're testing, they're charging you for these panels, that's just the money grab. I mean, that is unnecessary.
If anybody
So-
works with compounding pharmacy, the Bel Air Pharmacy, they're a family-owned pharmacy. And doing the compounding, those guys are fantastic. You can talk to the pharmacist anytime. She explains everything. I've been having a lot of my compoundings from there and my physician refers to it. And all of her patients use Bel Air Pharmacy and they're just amazing.
Yeah.
Compounding is just really, really great.
Yeah, you have a reliable compounding pharmacist.
One I really like is on Main Street. I've used it for myself and now my dogs. So that pharmacist is very nice as
Main
well.
Street
It's
where?
a little closer. Compound Pharmacy off Main Street.
Thank you, Herb.
No, Dunedin.
Actually, I think I've.
And they've been there, I mean, so long. Yeah.
Knowledgeable.
Yes,
Yeah.
and they will answer all your questions and they've been very good. Now one of my dogs gets something compounded there, so I'm very happy that they're close.
So yeah, if you guys want to send me either text me or whatever, all of the doctors that you love, the compounding pharmacies that you love, I'll just put it in all together in a document that you guys can use. And if you guys want to have, the in-body scan with Melissa, she'll take you for that. Yeah, that's part of her practice. Like she's with Bed VIP where you pay a yearly fee, but she said for that if anybody wanted to do this scan, she would do that for them. And she can interpret it for, she'll tell you how much, whatever it is. So but get with her if you want to do that, and I can get you guys her phone number too. And thank you. So I hope you guys, and if anybody wants anybody's phone numbers, get it if you just need to ask them any more questions, because I really believe in a community, and I really like everybody that ever trains here. I always try to introduce you guys to each other because I want you to know each other, and who knows when you can help each other. So, absolutely. Okay.
Thank you.
Thank you guys for coming. And if you want to take a thing on the road for you, tell it. I got a lot of earrings. Take it on the road. Thank you guys. Thanks, Rachel. Thanks, Letitia. Who else is on your list? Thanks, girls. I'll send I'll put a recording of this up for anybody too. And then did I miss a chat? Oh no, I didn't. Okay. Thank you. Yeah. Bye guys. I'm gonna hang up.
Bye.
I'm having needles, pins and needles in my feet.
Are you?
Yeah, in my hands. Oh, God.
It's so crazy. I know. I'm like, is it really happening? Oh, good to see you too. Oh my gosh, when you first walked, okay, I'll talk to you later. When you first walked through the door, I was like,
Yeah,
I haven't seen you in so long. And I'm so used to you with this shorter hair.
same.
It's
very.
Yeah.
And I'm like, I should have done this sooner. My hair looks a lot better long ago.
I think it's cute in both ways. I always loved your haircut before too, so.
They were
But.
fun. They were fun, yeah.
Yeah, cut it out, you know what I'm saying? And so I was just like, oh, like my not was. I was like, I found a book from like early like years ago, like 2017 or whatever. I was like, and so we did a couple of events in 2017. I'm like, is that the year 2017? Yeah, and I was like, oh my gosh, we were in Reed Fest when we did that. Yeah. Oh my God. I got back then.
Yeah, but I have to be like,
Yeah, for sure. Okay, sorry. Yeah, good. I use the top of the ladder. Awesome. Well, you're already done. So you have to, have somebody that. Well, there's no reception. Oh, there's not now. The only time I do now is Wednesday morning, 45,000. It's 6 to 6:45. Yeah. And Phyllis does. Oh yeah, and then Phyllis teaches in something on Saturday. Yeah, because it's so I was like, I was like, that's crazy. We have like back to back. I gotta sit in for a while. I know. So, but you know what? I was also the only studio on it, and now there's and so, and also I find it's a lot easier. And so, yeah. Do not go to club price. If you want to start Pilates, go and look. And CrossFit Pilates is awesome. I really recommend it. Anybody who's ever done it, sort of in a small group. If you want to do it on the former, I'm getting around for it. Like so, so I can do my training on it. But I mean, I got certified in Pilates in 2001, and I love it. And I just never really, I've incorporated it, but I never really, so, and the place where I work, we had a couch, a park barrel, and a chair. And now I just have a chair. But I like to do the mat stuff. But I would suggest doing some mats if you're going to do a plus Pilates, they're not required to be certified Pilates. And I know this because I'm a newbie, so I know that. So yeah. Yeah.
I mean, I like it,
I'm not doing it.
I just can't.
Yes, I did, I hated this part. Pilates was really boring to me for a really long time, and then I got back into it. And I was like, now it's so, I do a very confusion in Pilates, like I do. You know, yeah, it's definitely harder, but it's definitely, I mean, I think Pilates is great for everyone.
Yeah,
It really should. The first
And she But she just moved from one thing to another place. I'm second grade. And I want to back up from,
I don't want to start. I can't take it.
I'm like,
He's like, we don't have to fight you. I'm friends. I like to just go. So that's when I do my own research. I got that probably 4 or 5 years ago.
no, I don't hear it at all. All of this stuff. Like I just like, is it I don't like I used to get food so bad I couldn't eat for like 3 hours straight like when it first started and now I'm like and that's it. So it's all like it's all working together, all these things. I'm gonna pass my
Right. Thank you. I wanted to find there's a whole chapter in here. And I couldn't find it because I couldn't find it. But you know, it's
Yeah, so it'll be.
My mom, like, family, yeah, is like
No, you can't take any more.
That's sorry. I want to say,
And then it wasn't only my grandmother, it was her sister. But it was still, we got our breakfast done and no one. They're like, no, you can't take any more.
Yeah.
Now she, you know, they just.
I would be scared too. It's all kind of scary. I had to tell her this is ignorant and I saw her post and I texted her and she was like, oh yeah, we got some.
Well, and that's like a message.
Yeah.
So like I'm like crazy.
So I just know.
And now I'm even though I have it here.
Yeah.
So I'm gonna get flagged. You can lay down inside of the night. I'm gonna be so I go there, I look at it.
Oh, really?
And I do, so I went, yeah, but there's no.
No, I'm doing.
I was to
Yeah.
and then so I went to this and I started you'll be fine. And they were all
Yeah. Like all these like supplements over the counter.
Yeah.
Yeah.
And everybody
So you have done
And I went
with Theo.
yeah, I started so we had like, oh yeah, so previous like. So 112, and then I had sensors.
like, oh my.
This is the first time since I started all this. A lot of them people that I think now that what I'm doing is I never see a lot of what I do. And I think that a lot of them information was like the more I would weight train and the more I would just eat everything and more carbs.
Yeah.
I never would cover to my body. Yeah.
Well,
That's how I was gonna do it.
You're done.
Okay.
It's my basis. My name is
Yeah, you're so
So that's my story of them.
You know, when your mom said no, you could drink every now and then, you know, and like, this is, you know, swim on me. So people are like, I don't have a lot.
Yeah.
You know.
Oh, yeah.
I didn't know if you had cards under this.
I do.
I was so scared, we were so black. The sea trough was coming up, when I swam, like my arms get wet, that sea.
It was, France.
Oh,
And I had to stop and try the water. And I got seasick, I threw up while I was treading water. And, you know, the boat came up and I said, I'll be here for like. Yeah. And I said, She had one first. I can say this whole time you guys did a whole for that. Two of us. I got saying.
Yeah.
Thank you, Teresa.
So I'll have it after.
So I was like, how? That's a long time to watch.
Like most people don't see her stay in the outside part, just her address.
But her friend,
But then I kind
and I was like trying to tell her, she's actually.
Yeah.
Because I thought. We had sex.
I can buy, I can go.
Right.
see.
So I was like, very original. So I was like, I got phone calls today, or whatever. Maybe there would be something. Yeah. Garbage over there.
Yeah.
They lose their.
Like we.
It's got like urinary frequency.
Oh, yeah. Never looking at. Every now and then I'm like, oh, it's about to. And then as soon as you posted that, I was like, oh, and I didn't like to say that was for about it, and I still get now.
Yeah, I know, it's so funny, everybody was not that, like, the hormone.
She did all of it. It's true. I'll design it that. What kind of practice waited on? That's not private. I still do. Oh, okay.
Yeah. So I do primary care, doing my husband, my kids are in here. So family medicine care, I do like a concierge.
Yeah.
You guys friends?
What's the difference between the red and the purple? Which I together.
I think that helps.
Black maybe this is
Because I love.
I got flooded out really fast. It's far. Even in a big place like this.
Yeah, that you guide with, yeah. I feel like I.
So what are your thoughts on the GLP-1?
I always get some motivation.
name here, they probably have really good groups.
Oh, yeah.
So like, they don't. They don't get
No,
it,
it's not.
and then they're paying money for it not working, so then when I do thing, they're like, oh, that's what. So I use
I
the
would
knowledge that
I
found
on
this
myself yesterday.
Yes. Basically the
Saturday, so I ride my bike on Saturday, but I run and
I'm
training,
so with that time.
I'm not gonna be able to keep up with you.
Or is it in a
With what? With any,
Oh,
the
it's in a
paddleboarding or the kayak.
Do you have?
I'm not good at it.
Fast.
I'm not good at it. I had a hard time crossing the channel. Like,
Well, I was
I was like,
thinking
you
this.
Each
Does she
patient,
know
I
how
have
to
to swim
I don't
everything.
remember what
I'm
you said.
really
Yeah.
terrified of water.
Because
It's
it's
a
kind of significant.
So I
because
have a little bit of anxiety
very
going
bad.
out when I can't see
You
the
know, I've
bottom,
been doing this a long time.
which is why I really like
Yeah,
Yuki-Washi,
really
because I can see the
mess
bottom.
you know,
but
with that, they're
I've
not
been
done
trying to make
correctly.
myself go, but like,
Depends
I
on
went to the
patient's
kayak,
status. Some of my
and it was
patients
from
don't do that.
honeymoon, I mean,
Just
from
depends.
Yeah.
Sail honeymoon
Some of
was
them
the
are on
kayak
really
ride to
tiny
Causeway,
boats.
just right over
Fine
to
with it.
that little
Yeah,
beach.
but it just
And I was like,
depends.
because that was
Yeah.
far enough, it
I
didn't
get that, I
take
can
too long to
understand
get
that.
there.
I love it.
But I
and it's been
literally
great
felt
for me, but I
panicked
feel like
going
I'm
over the
gonna
channel
have
and then wanted to
more
leave, so I was like, I'm
inflammation
gonna fall over and
properties.
die.
Somebody with you?
The less inflammation, but I don't want to.
You know, so and then I made it, and then I
And I'm
stayed
on
there for
such a
a
low
really long
dose
time
already
before I
that
went back.
I don't even
I
know
thought
how
I
I
can't
would.
go back.
So,
So, but I tried,
Yeah,
I'm trying
go
it, you know,
longer.
because it's just like, I have no one really to go with,
But
so
you also want
it's
to
just,
realize which
I'll just.
But that was
realize
when
that
would
with
we paddle?
just
So I,
that
so I bike, you know,
there isn't
I bike Saturday, sometimes.
our body, no, they're not preventing
Sundays.
our
Right. Okay.
because it
And then
does
it's when
attach to
we're
certain
doing
receptors and creates
So-
an autoimmune reaction.
I know, you just
So-
let me know.
August.
You let me know when your training is done, and then we'll just follow this for fun.
When's August?
Innate.
I don't even know
Right.
what his
You know
body
what I
needs.
mean?
Yeah.
That's not good, you don't wanna do that, so
Yeah.
that would be horrible.
Right.
So it's like, there's this delicate balance
I
that
do
we're
the same, but I don't know.
See, and
how
that's
to do
where
it until
I
keep
Until you
doing
do
I
it.
feel like.
You know what I mean? Like,
Yes.
Taking care of something
Yes.
that's not.
right now, I'm very slow in my
Like,
bike and
Sure,
there's,
I'll write you the
there's
prescription.
so it's like,
Because
if I
I,
can't get
I'm not, I'm
faster
thinking
by.
ahead, you know what I mean? And I'm
Okay.
like, okay, so
It's
this
like-
is doing well for me, but
You know, should I still buy my
like,
ticket?
what am I
now?
gonna do?
What happened?
That's what
I
she
don't
said
wanna
about
have any
her,
problems, but
chair.
I think that
she
because I
she
don't
have
have
chicks
to
that got shells for
that I don't wanna have it even.
But how's
if I
your
did
house? Did
before.
you, everything?
So I
I'm
don't
back.
even like.
But that,
There's
so yeah, I
newer
mean,
things, but
the yard is terrible, which is why I haven't cleaned my paddleboard, because
Love
my,
it, obviously.
it's all mud.
Right.
So I take the
Yeah.
paddleboard
But then
out,
when
I
you
clean
get that
them,
long
they're
term, you're like,
really sitting in mud.
I don't
So
want
I need to take them
to your
somewhere.
own
but they're
GOPs and your own
But the house
body.
is good,
Right.
but
That was
everything is
nasty.
Yeah,
Yoga.
that's awesome.
So
Yeah.
maybe,
Or-
How would you
it
even
was
know
done very
that
quickly.
that's
So
happening?
I
There are some definite areas where I'm like, oh, should have done that different, oh, should have done that different, but whatever, I'm in my house and
Yeah.
I don't care, but, so, and I'm in there by myself, which is nice.
Oh.
So you're,
Okay.
He's
So
next
a lot
door.
of them have a skin
He's
reaction.
next door.
A lot of them
Next
have
door.
fatigue,
Literally.
rejection, a lot
Because
of them-
I
there's-
wouldn't let
there's
him
just
back
more
in, and he moved in with my neighbor when he moved
that I
out,
do with
Oh,
Wegovy.
okay.
and he's still
Oh,
there.
I see.
So semaglutide or
Like, I can look out my bedroom window, right?
67% cause that autoimmune
but at least he's next
reaction.
door.
But he's next
He's
door.
not in your house.
Yes, and I changed the locks
And
and
I
taken
don't
it.
think
Yeah.
daughters
And,
are
that was
that.
the
They don't realize
that was
They
a big
don't-
problem, and he got really mad,
So
but
some
he's over it. And I went and saw
Oh,
and
Yeah,
It's
not like him.
to do anything for it, like long term.
right.
And Wegovy is now capped too, but only in 10. Step down, you can dial the pen.
But,
That one's
every
extremely
time
expensive. Cash pay.
Yeah.
Wegovy cash pay is 500 a month for the pen.
I mean, but a lot of them are like,
But you can't play those with the pen.
You know,
Have you talked to him about it?
so I can talk to them face to face more than that. So I need
But
to
the
get
Zep, the Zep Bell has the vial.
You know what I
They're
mean?
coming
So
out
I
in
wanna get the
all the
paperwork
time,
done,
They're
Yeah.
not in the
and he's fine,
obesity
I've got
action for
No
which
female,
any
no
of the
female.
I
societies.
have been
Right.
one that will be, like a 30 minute consultation.
Yeah.
It's free, they all, the female that was recommended to me was
I totally
What's
understand.
the year
I
and
just feel like
Okay, no,
patients
never mind.
that
Yeah.
So
get really sick.
my
Yeah,
next
and I'm
plan of
very
action
new to
is
this,
to go
and I
see an
already am
attorney
like,
in
okay, that's what I said, like I
We do
said.
pay per hour.
I am nervous about it, and I do want
And I just
to know, I'm not just the type of person who takes something blindly,
And
and
then
that's
to see
why,
right.
like, I second
Well, let's
guessed
go
it for
back,
so
so
long.
we just need.
And even
7
every week
people
before my
to
induction,
So you can have your patient.
should I do
Is that
this
what you're
this
saying?
week, should I wait,
No,
like, what should I do?
$3,500 for your therapy. That's what,
Right.
that's why I
It's
don't
hard.
wanna do that. That's why I'm like,
really hard.
it's $3,500 to see
I'm
an
only
attorney.
one in this
to
town
have
that's
them do
sports
all the
related
work.
in it, so it's like,
Yeah.
there's not a lot of people that you can ask or talk to.
Yeah.
Most primary say no, because they don't want to deal with it.
Yeah, that's my, yeah, I really would prefer.
But, and,
You do
I
this,
mean,
let's
that's
connect you
something
guys.
that, yes, works for-
I wanna see
Yeah.
that, like, I know,
Right.
yeah, I'll get there,
Yeah.
right, I just finished my house, I was like, no, next, sorry.
So you have to.
So that's like what.
I can take it out of my OnlyFans
And
account.
I get the effect help.
Me too.
Yeah, and if
No,
you, yeah.
No, I, the thing is, I got the money, it is left over from the
You
insurance.
never know.
It's just that,
Yeah.
I'm just trying not to spend anything.
Yeah.
But you need to be like,
You know,
it's like, what's.
Yeah.
It's where it's close.
Yeah.
That's why people like, I don't wanna think of it.
So if I could just figure out, if I could see Shirley, like, how many dollars
Some
you're working
patients
on,
use the
I
hormone.
want something like that.
But
So,
that's-
I found it on the
You know, like, it's not like something that you just.
Like, this year, I'm done, If it, we were hurricane, it was like, I'll this year, I'm out.
I know, I wanted to live there. I know.
You
we
know,
don't.
So if I came to you, would you be able to help me navigate?
There's a small one.
And I can
on
either
the
have
house.
a young person
Yeah,
with
yeah.
me. But if I wanted to switch over or take a break, then we could talk about that.
No, it's just,
Yeah, I mean,
it's just, it was just this little house.
No, I know.
Oh, yeah, like,
Yeah.
it's not like, you wouldn't need to be.
That was
Right.
You're not gonna have some.
Yeah.
I would never,
I was,
yeah, I
there was
would
nothing
never
around
go
it, like,
from
very
there.
clean. It was just plain.
Like I said, not being able to have that.
This was a
I
while
was
back.
almost couldn't have it because of that, and I was like, I will never take that stuff again. But then, yeah.
Yes, I might not get funded, so, I mean, last year, the only one we did ask.
Because we want them. That's fine. Right.
Yeah.
Don't want them to pin them.
So, right.
I'm not doing it again.
Get in and
That's
get out.
what I'm thinking. I'm like, how am I gonna,
There goes that.
There goes that one.
Fix our house and, you know.
do this for the rest of my life? Like, no, it's not.
No, it's not. No, it's
So,
just.
yeah.
Because I'm
No,
not
you
sure
should do
sometimes.
that.
There's
Alright.
that way I kind of
That's what I
water,
would love.
No, you don't have to be over there.
No,
Close to that. You can just solve your body there and then.
Yeah.
It's,
And then you're not.
I think, yeah.
It's in your sense.
Good, I'm glad. that's-
Yeah,
I will say, do you have a card?
It's in the back.
Oh.
That's fine, yeah.
Yeah, okay. I have to set up for tomorrow morning, so I'm like, I need to start setting up for tomorrow morning.
What's tomorrow, Thursday?
Thursday, I'm
Alright.
like,
I haven't seen you in a while. I know.
we miss having like a football song. Well, let's stop the F-bomb 5 times, that's coming.
Oh, I didn't, and I go, oh, I didn't hear
Those
that.
drinks.
I know.
I'm gonna come to. I think. I'm such an idiot, but you know, what can you do? But no, what does it say on it? You have them here?
I didn't call, I'll see you, I don't know when I'll be back.
Yeah, like,
Oh, yeah, no.
Yeah. Can I help you, Sherry?
Bye, guys.
Okay,
bye.
Oh, sorry. Oh, I'll post with
I know. So what am I making an appointment for to get the?
the in body and body. In body.
A lot of people are like, feel that way about an IUD. I was always like, I mean, after like me doing it, I'm like, it's for my birth control, then you have your period, I'm like, oh, I'm totally getting one of those as soon as I have my last kid. Had one ever since. And I don't feel like I'm super sensitive to medications, and I know some people are like, oh, it made me feel weird or what, I mean, but it's really supposed to act mostly locally, you know?
Yeah.
And just not having a period, it's just, I know, that
Life changing.
That's the best part. Yeah, I'll keep thinking about it.
Yeah,
Yeah.
Yeah.
Good to see you.
you too, take care. But the calories are low.
Yeah.
Let me see if this one's on here.
Is that, that's a beer?
So this is
Wait, are these-
170 calories, but 16 carbs.
Wow.
And like some of the beers I drink ones are like 4 carbs.
Are these, like, this one's like rest, restore, and sleep.
This
Yeah.
one's pretty good. It's like
That
an
was
easy
what's in
IPA.
Oh, really?
Yeah, it's good. I mean,
Adaptogen infused sparkling water. I'm like so old. I'm
I
like,
can't see any of this because
It's
like.
bar.
Right.
So these are
Yeah, they're all
sparkling
different. Some of
drinks.
them had like collagen, some of them had theanine, some of them had like.
Elevate, zero alcohol.
there's so many options though. Even at Publix, they have a whole section.
Adaptogen. Okay, so they're all go to sleep.
All right, so I'm gonna grab a glass of wine.
This one is
Because I'm on call for the
Okay.
next. I did non-alcoholic wine before. It is not good, but the non-alcoholic beer is not bad.
This one,
I mean,
athletic.
This one is this brand is good. They have one that's like a this is like a
Okay.
golden. This one's a hazy IPA. There's one that's like a Corona. Oh, this might be it. No, this is just an IPA. But they have that. Yeah, I don't know. They have that at Meyer.
Meyer. Yeah, she said that they had just gotten those
One
in.
mild IPA. All right, I'm gonna try the golden.
Yeah, it's
Not right now, but
bring it. It's good.
all right. And this I will do. I'm gonna unwind, let loose some
Basket.
fun.
Holy crap.
Not. I think someone
Well, I
had a
think
beach
I have
share.
to.
Yeah,
We don't care.
Well,
Nobody
and
cares.
the problem is I have class in the morning and then I have clients 7, 8, 9, 10, 11.
Clients don't care.
Yeah, they will care.
All
All
right.
right, I'm coming tomorrow. 'cause
Okay.
I have to go to Michigan and.
Stop it. You're going been to too many times, Dana, like a protest.
I've been here for a week and a half.
Yeah, that's true. You have been here for a while.
I can't believe we were out here.
I know.
I know. Bye, girls. Thank you. I'm gonna lock you out. Thanks.